COVID-19 has claimed yet another life in Karnataka. This time, a 65-year-old man passed away due to COVID-19 in Kalaburagi. With this, the total number of deaths in the state rises to 5. 65-year-old man from Kalaburagi who died had a history of severe acute respiratory illness. However, no contact or travel history has been specified by the health department. In the midday situation update on COVID-19, Karnataka has so far reported 181 positive cases of COVID-19, 6 new cases including a death in Kalaburagi. So far, 5 people have died and 28 people have recovered in the state. Let's take a look at the travel history of these patients who now have tested positive. 6 patients to be more precise. Patient number 676 is a 26-year-old female. She was in contact with a person who returned from Dubai. She's been isolated at a hospital in Bhatkal. Patient number 177, 65-year-old male. He was isolated at a hospital in Kalaburagi. He has succumbed to COVID-19. Except the death in Kalaburagi, everyone has contact or travel history. Let's go across to my colleague Adarsh, who joins us live from the newsroom with more inputs on it. Well, Adarsh, this is the second death in Kalaburagi district. What do we know about patient number 177? Since he does not have any specific travel history, does that make this case a case of community transmission?
Well, Neha, at the outset, that is what it really looks like, given the fact that you're only talking about severe acute respiratory infection that the patient number 177 was infected with. So, yes, we're talking about a 65-year-old male, and yes, he was from Kalaburagi. So, unfortunately, this is the second death that we're talking about from Kalaburagi. With this, the total number of deaths has gone to 5, and the number of positive cases in the state, including the deaths, has gone to 181. And given the fact that you have not just patient number 177, but several other patients already in the 181 patients who have no travel history, but who have still contracted COVID-19. So that only goes on to indicate that we are really at stage 3, and that has been said in the past as well. Experts have constantly warned about how India is heading towards stage 3, despite a few corners, a few murmurs from the government that maybe we are not still in that stage yet. But it is clear, it is a clear-cut indication that we are in stage 3, that is community transmission. And if we were to just go through the details of the patients, the 6 new patients who have in fact added to the list of positive cases from the state of Karnataka, which has taken it to 181. We'll start with patient number 176, who happens to be a 26, very young person compared to the kind of age limit that we have seen. So 26-year-old female from Uttara Kannada. She had severe acute respiratory infection. Now, again, this is a respiratory illness. Shortness of breath is what is it being called, and it is one of those major symptoms going into COVID-19. And in fact, most of the patients that we get have this particular sign or this particular symptom for sure. And again, this particular person, when we talk about patient 176, had a contact with the Dubai returnee. So currently designated hospital at Bhatkal in Uttara Kannada. Again, patient number 177 is the patient we just spoke about as to how the 65-year-old male did not have any sort of travel history, but still went on to contract COVID-19 and eventually had to lose his life as well to that. And before that, he was isolated at the designated hospital in Kalaburagi. When it comes to patient number 178, interestingly, there's a contact history here with patient number 175, who also had the severe acute respiratory infection. So patient number 178 happens to be the mother of patient number 175, again a 72-year-old female from Kalaburagi, also isolated at the designated hospital in Kalaburagi. So patient number 179 again is a 35-year-old male from Mandya, had a contact with patient 134 and 138, and patient 180 is a 23-year-old male, again a youngster from Chikbalapura, had a travel history to Delhi. It remains to be seen if there is any connection with the Tablighi Jamaat event, the Nizamuddin event that took place. And currently patient number 180 is isolated at the designated hospital in Chikbalapur. And so is the case with patient number 181, happens to be a 27-year-old female, travel history to the national capital and from BBMP Bengaluru limits. currently designated at the hospital in Bengaluru. So this is what the patient history or the details that the bulletin has put out at this point in time. So grim details, given the fact that in fact all of them do not have any travel history abroad. They only have travel history to the national capital, and some of them do not have any travel history whatsoever. So yes, it is clearly stage 3 community transmission that we are looking at. That apart, a couple of interesting details that the medical bulletin has put out. It clearly says, in view of breaking the chain and containment of COVID-19, the Karnataka State Board of AUQAF Bengaluru has directed to all the managements not to allow any congregational prayers in the masjid and the managements of qabristans, dargahs throughout the state, and to suspend the visit of people on the occasion of Shab-e-Barat. That's again happening tomorrow, 9th of April, where you have members of the Muslim community come together, and it's almost like you stay throughout the night and you indulge in prayers. So that is what Shab-e-Barat is about, and that happens tomorrow. So there should be no gathering, and that's coming in from the Karnataka State Board of Awqaf itself. So they've clearly said that masjids should not be populated. People should not come to the place of worship. They should go ahead and offer their prayers from home itself, and they should also observe this occasion of Shab-e-Barat. Happens to have a lot of people coming together usually on a yearly basis. So that will be observed from home itself. So no public shall be allowed to perform religious rituals in the qabristan, dargahs, and all the gates of qabristans and dargahs shall be kept closed. So yes, you have a couple of measures being taken on ground as well, and that really shows in the announcement that has come in the medical bulletin that has come forth. So yes, a couple of important pointers as to how the government is really looking at ensuring that you do not have too many people piling up or too many people crowding at a certain place, given the fact that, again, we can go back to the patient history as to how there is no travel history, abroad, but you still have patients contracting COVID-19. So the need of the hour is social distancing. The need of the hour is to ensure that people do not crowd, and there seems to be a few measures almost on a daily basis that are being taken on the ground, which really reflects in the medical bulletin.